Hi, I'm Kristen Burt for LifeScript.com. How should a parent handle their child's Crohn's disease diagnosis? Cedars-Sinai's Dr. Shervin Rabizadeh gives some great advice for families dealing with a Crohn's disease patient.
I want to know, we've talked a lot with adults who have Crohn's disease. What is particular about kids with Crohn's disease?
A lot of it is the same as the adults. They have similar type of symptoms in terms of the abdominal pain, the diarrhea, bloody stools, fevers, so forth. But there's also some unique aspects to pediatric inflammatory bowel disease. Specifically, a lot of it is growth related. Children, especially with Crohn's disease, can be much shorter than they're supposed to be. They can be quite underweight overall, and that has a lot of bearing in their life, whether it's at school or whatever environment they're in. Also, their energy level can be really depleted, adults as well, but when a child's energy level is depleted, they're missing school. So there's a lot of psychosocial aspects of that as well for the children.
Now, I know it's an individualized course of treatment. What are some of the steps that you'll take immediately to help the child feel as best as possible?
Well, it's exactly what you said at first, which is that it's an individualized treatment. So a lot of that depends on where the disease is at, how it's been acting up, what kind of symptoms they have, what we found on our diagnostic testing. And based on those things, then we can find the right treatment for the right patient at the right time.
What about diet and nutrition when it comes to a kid? It's hard enough to regulate when you send them off to a birthday party. Now you have something extra to worry about.
It's a great question, and we get that question a lot about what do we do dietary-wise. If you actually look in everywhere you look and you put in Crohn's or ulcerative colitis, there'll be 10 million diets that these patients can do. The problem with some of the dietary approaches is that they don't work as well as we want them to do to control inflammation. They may help with some of their symptoms, how they feel generally, but they usually don't help their long-term kind of disease status. It's again an individualized approach where a lot of times we're assessing the family, assessing the patient, and determining where they're at. There are some of our patients who are very enthusiastic to go on some type of dietary approach along with the other treatments that we're doing, and we support them through that process. We have a nutritionist, dietitian with us in clinic who will make sure that they do it in a healthy way and kind of go through their different options. And we have other patients who either the parents or the child are completely opposed to any sort of diet. One of them wants to do it, the other one doesn't want to do it. And a lot of time our discussions are that, we got to back off a little bit, make sure that they're getting a healthy, full balanced diet, but the stress that may cause to kind of have that battle about the diet in the household, the stress it causes more psychosocial issues, and it adds on to the stress that's already in the household to begin with.
You just mentioned the psychosocial issues. That's a huge component with a chronic illness, besides worrying about the physical aspect. You treat kids a little bit differently than adults, I imagine.
Yeah, we do have a social worker in our clinic environment. So in our pediatric inflammatory bowel disease team, we have the physicians, we have a nurse practitioner, we have a social worker, we have a dietitian, and we have a research team. And all these components are brought together because these are different aspects of the disease that we need to treat.
And how about the schools? Because it's very important to get the schools involved in understanding how to deal with a child who has Crohn's disease.
So this is a big component that we have to work through all the time. California law allows something called a 504 plan, which is helps children have a designated plan in place that allows them flexibilities that are needed for a patient with an illness. But even that being said, there's a lot of stereotyping of this disease, and there's a lot of confusion. A lot of people associate inflammatory bowel disease with irritable bowel syndrome. And those are two distinct entities, very different disorders. And the perception is then people start to say it's in your head. The child has belly pain or has to go to the bathroom. You got to control this and it's in your head. With inflammatory bowel disease, it's not. I'm not saying it is with irritable bowel syndrome either, but especially with inflammatory bowel disease, you have an active inflammatory process going on inside your intestinal tract where your own defense system is attacking your intestinal tract. In that way, this is not a situation where it's all in your head. So a lot of it is education to make sure that the teachers and the administrators understand that these children do need a little extra help at times to kind of get them going. And then they do miss a lot of school. So we work with them very closely and contact the schools to try to make sure that they stay involved, that they continue their work, and we try to get them back in school as soon as we can. That's critical, to try to get them back into mainstream, get them back into school so they're just acting like everybody else.
Normalcy is the best thing.
Yes.